My name is Francis Ochen, and welcome to our June 2023 ECHO session. Our session will run for now about 50 minutes, and we'll take one shared presentation and then dive into the questions and answers. Kindly, like I indicated, please join us through the chat room and have your questions posted there and be observing for some of the responses. In our today's session, we look at the National Laboratory Network Performance Management. We will be focusing on using key performance indicators to drive effective laboratory value chain returns. Just like any product and service industry, effective and efficient and reliable laboratory network relies on a deliberate and structured efforts to continuously look for critical areas that can aid or diminish performance and monitor them continuously. To accomplish this, leaders select key performance indicators to track progress, evaluate results, and act on the gaps based on the results of their evaluation. And so in today's session, we review how Eswatini Health Laboratory Services have put up systems to hold all levels of their laboratory network to expected performance. And to take us through today's sessions, we have Sindisiwe Dlamini, and Sindisiwe is the Chief Laboratory Technologist from the Eswatini Health Laboratory Services. And Sindisiwe will be supported by Bui Simaleni, who is the Associate Director for Monitoring and Evaluation, with still the Eswatini Health Laboratory Services and LabCoP. Colleagues, join me in welcoming our two presenters, and I have now the pleasure to hand it over to the first presenter. Sindisiwe, over to you.
Thank you for the opportunity for Eswatini to share their experience using KPIs, key indicators to drive their performance. Will be shared between myself, Sindisiwe Dlamini, and Buyisile Simelane, our M&E specialist within EHLS with the support of LabCoP. We are the Ministry of Health Laboratory Network within Eswatini and level, and have set the key performance to monitor lab performance. My presentation outline on brief background of Eswatini, defining KPIs, and steps towards establishing, operationalizing KPIs, and then the KPIs themselves, the specific areas. We had many areas on which we wanted to illustrate, but 4 areas, that is with our strategic plan, with our supplier performance, with facility performance, as well as with our monitoring and evaluation, which is our data. Then we also want to highlight where they perform. Those are the guiding documents, tools, supporting systems, CMIS, client management information, lab information to drive performance. Then we'll discuss the results and therefore the conclusion. I will give over the presentation at some time midway to my fellow colleague Bui to continue with it. Thank you. Eswatini, who are we at Eswatini? Eswatini is a small landlocked country situated, sharing its borders with Mozambique and South Africa. We have a population of approximately 1.3 million, and with the top 7 causes of death being HIV, lower respiratory infections, ischemic heart disease, diabetes, stroke, diarrheal diseases, and as well as TB. This is from the CDC 2018 report. Then according to SHIMS 3 2021, the adult HIV prevalence is now at 24.8%. To decrease its HIV incidence amongst adults from 2.4% in 2011, that is our incidence survey in SHIMS 1, 2.62% in 2021 in SHIMS 3 study. The 0.62 incidence means that we have approximately 4,000 new cases of HIV a year amongst adults of ages 15 years and older. And the background of Eswatini Network Laboratories, who are we? Eswatini Health Laboratory is the laboratory under the Ministry of Health. They report to the clinical deputy director in the Ministry of Health and then the director of health services. We are structured in this tier. We have 60 mini laboratories that are way in the community where we have mini labs doing point of care testing. Then we have health center laboratories. These are within the region. They are a few beds health facility that has a laboratory fully functional to support art initiation and art testing. And then we have hospitals laboratories, which some of them now have even a microbiology component, increasing their scope. And then now also 4 reference laboratories plus 1, which is in the pipeline. How do we then work around? We have a sample transport network system, the national sample transport, that moves samples from the clinics to these 2 sets of laboratories to enable testing for the clinic facilities, and then as well return the results. We also, this sample transport network has scheduled routes. They know the car 1 and car 2, different routes they go per day. So each car goes to a facility twice. If it goes Monday, it will go Monday and Wednesday, and the other route, it will go Tuesday and Thursday. That is how we schedule. Then every Friday, there's an M&E where they bring back their data on how much they transported and how much were rejected on site before coming to the lab, because these are trained phlebotomists as well. What are KPIs? I must say that K stands for key, that which means the most important. So here we want to pick, we have lots of things that we do, but we want to just pick the most important. P stands for performance. This is directly related to the success of the laboratory or success of that strategy we are enabling. And then indicator, it shows the direction and provides clear feedback around if current performance is aligned with the goals. So this is what KPI stands for within our presentation today. What are the key performance indicators as Eswatini Health Laboratory? First, we derived our performance measurements from our strategic plan, which is a 2021-2023 plan. These KPIs are high-level measures of performance towards certain objectives and applied across departments. They are designed to provide insight and track progress towards attainment of the goal. And the KPIs are tracked at different levels. Some are tracked weekly, like our viral load. Some are tracked monthly. Some are checked quarterly, annually, and as well as end-of-term evaluation by the strategy itself. And how do we establish and operationalize the key KPIs? We just don't sit and come with KPIs. It was when our strategy was approved for the whole plan for 21-23, there were key stakeholders. We mapped our key stakeholders and we invited them to develop the operational plan. Then each strategic objective was assigned key performance indicators. How are we going to see we've achieved this strategy? What is the most important factor? Then the teams were formed and assigned responsibilities of each objective. Then routine measurement system is developed and put in place. And then we established the monitoring plan, which includes reporting, weekly formats, and plans to address the results. Performance evaluation of strategic plan is conducted annually, which we kept reviewing every year. What have we done? How did we not achieve? And then we still hope to be doing our end-term evaluation sometime before the year end. Then the 4 key areas that we've selected in our discussion today to monitor KPIs for the lab network. It's our strategic objectives, our facility performance, supplier performance. By supplier performance, I will explain within my presentation, and also the M&E, monitoring and evaluating of all the systems as well as the data. So what are these KPIs for all these areas? That's the question we ask ourselves. For our strategic plan, we had different strategic objectives, and under each focus area, we set up different indicators. Where under administrative and structure, we looked at the strategic plan approved, which was easily done. Then we looked at under quality management systems, number of labs audited. We just picked out the key things that we want to measure ourselves with. Under equipment and supply chain, we wanted to optimize, do our D&O guidelines and approve them so that we have standing documents. We did a D&O in 2018. We did a D&O in 2021. We want all those guidelines to be clear. When do we set out to do a D&O? Then we have the quantification of lab reports, technologies placed within the MRU, medication regulation unit. Those are the things we want to set in place that we put in each strategic KPI, as well as under improving diagnosis and coverage, wanted to increase the number of mini-labs we are servicing, even with the transport. Then we still have an objective where we want to establish the public health lab response. And as we've seen in COVID, we made some system run for public health, but now we want it to be institutionally established. Then we have strategic information where now we look at all the information, be it the data, the annual reports, all absolute hardware. These were the strategic areas where they wanted to put out the clear things that they will follow within their strategic areas. And the supplier performance. This we have learned very well. As we scaled up our viral load, we were bundling our supplies with maintenance with our commodities. We needed to set key performance indicators with our supplier, what we want from the both of us. We schedule plant maintenance should be done and scheduled. Those are the things we review every quarter. The number of hours lapsed from initial support call, we make a call to the vendor. We want them to respond within less than 24 hours. Then the number of hours lapsed after initial service on call job is completed. We would like them to fix a problem with the instrument with less than 48 hours, that is 2 days. So if it's anything that we recorded within that quarter, then the number of outages, which okay, because once we fix an equipment, it's not just, it will all work. Sometimes they're here for a service and immediately they leave, something happens. So those outages, we say they should be less than 2 per instrument per year. Then the total % instrument uptime. We said to the vendors, we need the instrument to be up 95% of the time under the service and maintenance, so that this helps us to keep our deal with the targeted tests and enable us to reach, because when we said KPIs, also a test agreement that we said we want to run 30,000 tests per year. If that uptime is not greater than 95, then we are going to not to meet our target of 30,000 tests. Then reporting and management, we said key KPIs in terms of quarterly reports submitted within 30 days of each quarter. Then the number of meetings held. So here we have the customer, the customer. There's also the in-country service, the out-country vendor, the one who does supply chain. So we always have to have a meeting per quarter, because sometimes we don't order, we have a buying mechanism. They have to be present in these meetings so that everyone is visible of these KPIs that we are working together on. In terms of supply chain management, we have the number of stockouts of any reagent or consumables for which service provider is responsible, leading to interruptions. what is this? Maybe someone will ask. Remember, they ship, it's supposed to be cold chain. If it happens somewhere, they lost cold chain, we do tracking of the thermometers through transit. And then if that stock out happens, then that is what we then write to them and claim the amount of stuff that is reagents that are lost, and we are reimbursed. And at facility KPIs, this one is interesting. With facilities, we set out the equipment downtime, reagent stock out. We want to know the facility's PT performance. We want to know the facility's progress towards closing NCs from the last audit. The facilities have a mentorship program that we are supporting the facilities with. And also we want to know the sample rejection. For any reason, when your sample rejection then becomes more than the target, we then have to do a root cause analysis. We have to go back to the facility, do a site visit. Is there new staff? Someone doesn't know the procedure, retrain, try and find the cause of the issue so that we do not have our rejection rate going high. I will now share over Bui to go with the M&A KPIs.
Thank you, Chief. Please allow me to share with you in terms of the monitoring and evaluation KPIs. First, I'll start off with the data quality assurance. What do we do there? So routinely as M&E, we conduct data quality assurance activities where we look at completeness of data, we look at the validity of the data, we look for duplications, we also look for consistency, we measure the data over time, we check on the systems if they still give us the same results over time. We also have systems and tools that we use that we have placed. We also conduct data review meetings as well as evaluations. On the data reviews, that's where we just look at how we have performed in terms of the output. And then for evaluations, that's where we want to look at how we've been effective and any efficiencies, which is what we are going to conduct by the end of the strategic plan so that we can evaluate ourselves if we've been effective. Next slide, Chief.
It's not moving.
Okay. Okay, so I'm also going to touch on what has been the enablers for us to be able to achieve such great results. We have these guiding documents, which include the strategic plan, which gives us the direction of where we want to go as a lab. We have standard operating procedures we normally call SOPs. We have the manuals, we have operational plans, which we do at the highest level as a country. We also have operational plans at facility level. We have the CPD guidelines, etc. We also have supporting data systems, which include the client management system, the lab information system, shortly known as LIS, and also Aspect. We also have tools for those times where we have system downtimes, or for example, when we are still implementing or we just started where we need to collect the data manually, which include the request form, some log sheets, and then we have the team engagement to drive performance using existing laboratory platforms. These include the laboratory technical working group, where we discuss with the programs how we can improve, how the lab data can help in improving the programs. We also have laboratory managers meeting, which are conducted monthly. Next one, Chief. I think the next slide is going to just show examples of the different performance enablers. Chief, it's going to show the different enablers as evidence to show that these documents actually exist. I wish I could. Yes. It's not moving.
Yes.
Okay, please stop sharing. Let me try and share my screen then. Sorry for that.
Thank you.
Okay, sorry, I'm just right. Okay, these are now the key guiding documents that I've already mentioned, which we use for us to be able to see where we are going. This is the strategic plan. And then this is an example of a laboratory waste management guidelines. This is now an example again of the quality manual, which is from one of our national molecular reference laboratory. This is an example of the tools that we use. This is a request form for those times where we have to use the manual requesting of tests. This is a sample logbook where we log again if we have system downtime. And then this is one of the tools also. This is where we monitor our weekly high viral load. So again, it's this one is electronical. And then part of our performance enablers, this is now the supporting data systems that we have. This is the laboratory information system, which is interfaced with the client management system. So on these two systems, we actually request the test using the client management information system, and then they print a barcode from the facility, they paste it on the sample, and then only the sample will go to the testing laboratory. And then where it is scanned and the information will be transmitted, and then as well as the results. And then I think one of the key drivers of how the Eswatini team has performed is having this fantastic team here. We have, this is the team that was working on the laboratory strategic plan. It is also worth mentioning that when we were doing the planning, we involved facility level staff. We had people from management, admin, the partners, monitoring and evaluation, so that we have the different stakeholders, so that when we plan, we know everyone is involved and we can perform better. On this one, this is again in one of the annual meetings we attended. So we had the different programs. We had people from the civil society and the lab, which show the support that we and the integration that as a lab we have managed to secure in order for us to perform better. I'll just share a snippet of some of the results where we do our annual performance of the lab. Sorry about that. I was trying to, okay. Okay. So this is just to show how we monitor our strategic plan. This is now the implementation plan. We look at each of the years where it is black, it means maybe that thing is not applicable, or it was not due for that period. So we have achieved, we have pending, we have partially achieved it for that activity. It has not been fully accomplished for the different strategies. This is just an example. And again, on my far right,
okay,
it's not moving.
Then they've moved now, we think.
Oh, okay. And then at my top right, this is just an example of one of the objectives, which was able to achieve 67%. So when we do the annual reviews, we look per objective, how many activities they had, how many were achieved, how many were partially achieved. And then we plan again on how we are going to do corrective action if need be, or how we want to tackle that objective. If we feel that maybe for the previous activities, it was not done well. I won't go through each of these. And then this one, this just shows how we now append our documents once something has been done. This is an example of objective 5, where we document, we put the evidence to show that this activity was done. If we needed to develop a certain document, or it's a guideline, or if it's an attendance register, then you paste the link here so that we can know. If you click this, if it's in Word, it's going to open and you can actually view. So this is available within the team that was working on this. And then let me just go through some of the key performance for the supplier. So as the chief has already mentioned, that we do have these targets, and we review on a monthly and quarterly, depending on the different indicators. For example, on this one, where we were looking at the percentage of instruments that receive at least one PM visit per year from the date of installation, we were at 100%, and we are looking at the different laboratories, not just as a whole. So we are zooming down to see for each of these facilities. And then mean time to respond to equipment breakdown, which is time lapse from the issue first reported to the time and follow-up plan is communicated to the customer, which the target is within 24 hours. So this is also been achieved. I won't go through each one of those, but this is just to show that for each of those targets that we mentioned earlier on, that we do have supplier performance. This is how we are monitoring each and every one of those. And then in terms of the facility now, we have a monthly tracking of the statistics. For example, this is one from the National Molecular Reference Lab, where we look at the PCR, look at the plasma viral load, we look at the DBS viral load, we look at the samples, and then again by month. This one is just showing us for April 2023. We also track on the laboratory quality indicators. This is also shared during our monthly laboratory meetings. So we look at equipment downtime. This is an example from one of the facilities. We look at the rejection rates. We look at the days out of stock. We look at EQA performance. So again, this just shows how we track our performance at the different levels so that we can track and everyone is held responsible. And then we also have each of the laboratories during the laboratory monthly meeting, we show how we are progressing in terms of LKMS. We look at the number of NCs that we had at the last audit. We look at the number of NCs that we closed in the month. We look at the number of points that were gained on SLIPTA checklist, as well as the percentage gain on SLIPTA. These are just examples of what we present during the laboratory meetings. On this one, I just want to share some of the verifications as M&E, because we did mention that we actually verify, especially for those facilities that are still using paper-based. So we actually verify the reported numbers, and then what is acceptable is between 95% and 105. You can see that we were able to get acceptable numbers for EID, PCR, HB, RPR, and urine chem. The others fell off the verification factors. So there are different reasons to this. It's either some of the facilities did not report. As you can see, for hepatitis B, the numbers that we verified was 6,000, and the ones that they had reported was 55,000. This is now verifying data that is coming from the site. So you can see that the numbers are low, but this is mainly due to the facilities not submitting either on time or having difficulties to submit to M&A. Again, we also do monitor our turnaround time. Again, I'll give an example of how we are monitoring viral load. So it has been a very, very interesting journey for us, because when we started having the interoperable between the two systems, the client management and the laboratory information system, our turnaround time was so high. As you can see, in October, up around December 2021, it was around 40, on average, it was around 45 days. And with the introduction, as this system was being rolled out to many facilities, our TAT reduced drastically to about 17 days. And it's also worth mentioning that we had a target of 14 days, and we were able to achieve it by June 2022. And when we went to one of the targeting meetings, we sat down and said, no, since we've achieved this viral load TAT, we feel that maybe there is more that we can do. And we further targeted that, no, let's target for 10 days, so that by the 10th day, the result should have transmitted back to the requesting facility. And again, we were able to achieve it by October 2022. And by December, we're at 9 days. And then we had challenges with equipment downtime in two of the viral load testing laboratories, and also reagent stockouts, which has resulted to our TAT again shooting up to about 17 days in January, and it looks like it's going to up since in April, as of April this year, it's now at 25 days, but we continue to monitor this. And again, we still continue with monitoring and evaluation. This is now one of our systems that we use for GeneSpect testing data, where you can actually see the trends by month. But on this slide, I'm just showing on the testing by month, by year, from 2019 up to 2023. What is also interesting is the chart below, which just shows overall activity of the device, where the green is showing how many devices were active. You can see when it was a holiday or a weekend, and then you can see if we had any equipment that was down for repairs. You can see how many tests were performed, when were we out of inventory, or there was no staff to conduct the test, or we didn't receive any sample, or there was no power, or any other challenge. So this is part of the systems that we use. I think in conclusion, we want to mention that monitoring of the KPIs has ensured that the EHLS is able to have real-time information on what is happening within the network. KPIs are an important tool in providing feedback to stakeholders and ensuring that challenges are identified early and resolved timely. Also, having these regular review meetings with suppliers and other stakeholders has improved the performance of the lab. Again, when we look at the data quality assessment, this has also helped us to know, even when we started, I remember there was a time when we were like, how our turnaround time was so high, but it was an issue of us fixing the date of collection. We had challenges there. So having these data quality assessments have been very, very important in helping us evaluate ourselves and validate this information to inform decision making. I just wanted us to end with this quote from an unknown author that says, you can't even recognize the traps for mistakes that you have made before if you don't self-evaluate. So with that, I thank you.
Thank you very much. The team from Eswatini, very insightful presentation, very informative. You've actually demonstrated that performance management should be aligned to the bigger picture. So you start from the national lab policy, so to speak, and then the strategic plan. And then it is from there that you can develop your very effective key performance indicators, because then they're supposed to support you in evaluating whether you're actually addressing the strategies and the policies that you initially set out to do. It is also very clear that at different levels, we have key performance indicators that have been selected at the national level, at the facility level, and the different levels of your network, so that then you can pick any opportunity for improvement that pops up at all those different levels. So colleagues, we have so many questions that have come through the chat, and keep them coming. I am also happy that the team from Eswatini are responding to most of the questions in the chat, and keep also monitoring the chat for the responses. Now, let's take the first question, a general one, and I'll hand it over to the last presenters. You have shown that some performance areas, some indicators are actually already achieving their 100%, your 100, between 95 and 105 that you indicated is the acceptable performance level. Now, so for such indicators, generally speaking, what do you do with them? Do you continue monitoring them? Do you drop them? What do you do with them?
Thank you. For those that are performing well, but because the one on EID-PCR, it's one of those that is closely monitored because it's HIV related. We don't drop it per se, but you might find that we won't be monitoring it this year. Maybe after a year again, we just check to make sure that we are still on track. We don't want to wait for a long time until something happens and we are tracked or we are caught off guard. We may not necessarily do it in the next round, but definitely we will do it on the following one. Then the ones that had not done so well, we have we normally conduct a feedback sessions where we invite the clinician in the facility as well as the laboratory personnel, where we discuss how we can improve this. One of the things that we also noted was that for some of these clinics, you find that the clinician does not very much follow on how this reporting is done. I think for them, it was just getting the test, but in terms of the lab reporting, it was not done. And then we went to the facilities and talked with the clinic sisters, and it has yielded positive results from where we started. Thank you.
Thank you very much for that very elaborate response. Now, the second question that we are taking is from Emmanuel and others. And they're asking, because we know for you to do your indicator monitoring, you need to set the performance objective. You probably want to move from performance level A to performance level B in a certain time period. They're asking, what guides your target setting when it comes to what you want to achieve in a particular area? For example, proficiency testing, you've indicated 80%. Was that a random number, or there is something that guides your selection of the target that you may want to achieve with a particular indicator?
Oh, okay. This EQ, the 80% is actually the pass rate. Not that we were targeting to get 80, but it was this is the pass rate. So this facility was able to achieve. That's why we have 100%. But maybe to answer you to say how we normally set our target, we normally benchmark. We first do a what is it called? Baseline. We normally conduct baseline. When we're doing the strategic plan, we had baseline numbers, and so we're able to see which ones are the low-hanging fruit, the ones that we know. As you may know, that when you set the KPIs, you need to be smart about them. You need to make sure that these are achievable so that you don't get distracted along the way and feel that these are not achievable. So we normally sit down and have a benchmark to see where we are, and then we target. We look at the low-hanging fruits and see if we can be able to, it can be achieved, and then we check. And we also do this targeting. We don't just limit it to when the strategy was developed. We continue to monitor and target. If we feel that this one has been achieved, we look at how we can improve that performance. I'm hoping I was able to answer you. Thank you.
Thank you very much. Keep the questions coming. You can add, please, if you have something.
If it's in our lab, in our management review, when the lab presents to us their indicator, and if they've received the target, or that is when we do the adjustment. Should we retain it? Should we adjust it? Like the TAT, as you had seen, those are the things we do in the discussion within the lab management review time. so that we can adjust an indicator, some of those adjustables. Thank you.
Okay, and then the adjustments are based on some of the benchmarking that your colleague has spoken to. Okay, so the next question, we have a number of questions on your sample referral and network, and I'll pick just, I think, two that can summarize that. The first is on the fact that your drivers actually are trained in phlebotomy and biosafety, and therefore they may be doing beyond just sample pickups and drop-offs. And so Bernard, Emmanuel, Eric, Adademola, all are asking, are the drivers handling phlebotomy as well? Are they doing phlebotomy as well? But also for those that are doing phlebotomy, do you have a certification program for drivers that then are deemed competent to do phlebotomy? If you could just deal with that.
Okay, thank you, Francis. The drivers are trained and certified by our training. We have an in-house training as EHLS on phlebotomy curriculum. We certify them, we do refresher training on them. And why? Someone would ask, because they are going to sites. Sometimes when they reach a site, there might be a queue, and they need to mitigate. They need to help the phlebotomist on site to enable to collect the samples, those who are scheduled, understand the process, check everything as assigned. When you do the accession into their logging system, they must understand the whole process. And as well as when handing over the list and the samples to the main lab, they understand the process. That is why rejection rate has to happen at the clinic and secondary by the technologist when they receive the sample at that area. We train them. And like as the epidemics have come, we were able to train them on COVID. And recently we were sensitizing on them on samples for cholera, what's the collection, the swab look like. And the way the cars are structured, they have a 225 component, they have a room temperature component, they have temperature in transit monitoring systems. So those are reviewed, and we have a database of that information of each thermometers en route as well. Thank you.
Very exciting. And I hope that you can show a picture or an image of one of those cars just before we end, if you have it somewhere, because that was the other question and you've already answered it, the monitoring of sample integrity during transit. And it is really very exciting. And I think that answer also came through in the chat. Now, the next question that we will take is your network. You have your network, I think a 4-level network, the laboratory network. Where are the molecular labs located? And are your turnaround times for viral load part of the key indicators that you're monitoring? And at what level of your network is that being monitored?
Thank you. May I answer that one? Initially, we had our first molecular lab was the reference lab. There was one lab as a country. As we increased viral load scale up, we decentralized to all the other 3 regions. We have an instrument in Manzini region in 1 hospital, in Lubombo region, 1 hospital, and also in Shiselweni. So at the end, we have 4. These clinics from each region are sending their viral load samples to these regional laboratories, where we are enabling the turnaround time to be far better than when we are all sending everything nationally. That is how we've been structured.
Okay.
I would like also to add that in terms of monitoring our turnaround time, we monitor each of the steps. We look at when the sample was collected up to when it was registered. We also further look at when the sample was analyzed, and then when the result was authorized and sent back to the first. So we look at the different level. Just that here we just wanted to show you from collection up to results return. We also look further up to results utilization, but for now we wanted to present just this TAT, but we do look at the different stages of our TAT.
Thank you for that very good addition. So the next question, I'm trying to merge it, and this came from Rodriguez and Emmanuel plus others, and it relates to both your sample transport network, but also the general performance that we are seeing in Eswatini with regards to HIV care and treatment. The ownership of the sample transport network. We know that this, I think the answer was that this is owned by government, but is it hugely supported by donors? And then the other aspect to this question is on the performance that we are seeing, the results, the good results that we are seeing. Is this also very dependent on donor support, or it is a systemic structuring of your system that has really supported the churning out of these very good results? And with or without the current support, you may not necessarily be very shaken in terms of achieving your results, going beyond the current support that you may be getting from your donors. I hope that is clear.
Yes, it's clear, Francis. The sample transport network is government owned and supported by government with fuels and service. But in the recent years of COVID, we have experienced issues of fuel outages. That is when the partners come in to assist, and as well as the servicing. The fleet itself is always mobilized with any donor funding that we can get, just to refurbish, not even refurbish, always, because we've had the transport system since 2010. We have to rest some cars that have done their mileage and keep other new cars in the system for efficiencies. So this is how it's both government and the partners, but government pays the salary of most of the drivers, and as well as the fuel. It's mainly government, the partners support when the crisis is at hand.
Thank you very much. And colleagues, time is not our best ally. We have barely 2 minutes to end this. I know that there are additional questions that are still coming up. Please keep them coming. Those that we feel are not yet answered, we will pass them over to our presenters, and they will form part of what we will be sharing with you when we share the session materials. Allow me now to ask our presenters to just wrap it up in 30 seconds each, your parting comments. Sindisiwe, let me start with you.
Thank you, Francis. Thank you, ASLM, for the opportunity as Eswatini to share some of the KPIs that we have implemented, and we are still to enhance our service and never stop monitoring to enable efficient service in Eswatini. Thank you.
Melanie, please go on, but also you can answer the question of the coverage of your sample transport network in your summary. What proportion of the country is covered by the sample transport network as you summarize? Over to you.
I think the Chief, do you want to touch on that, Chief, just in case?
I think 3 regions are fully run by the government sample transport. When we lobbied the third, the last region, our father, the grant said we should hire, we're doing a courier in one region through government support, which we all have good lessons learned from that one. That is how it is structured. It has only 1/3 done by courier through global fund support. Thank you.
Okay. Thank you. I just want to say thank you for being given this opportunity to make MNE shine, because this was looking at how the key performance indicators can actually drive performance. Thank you so much, and over.
Thank you very much. And colleagues, our apologies again for the glitches that we registered during the start of our session. The certificate codes were on the screen. We will share them in our e-blast that will come to you alongside the materials should you need to pick a copy of your certificates. Till we meet next time, from us to you, have the best of the remaining part of your day, evening, or night. Thank you and over.